And then now we have the obturator internus. So again, remember you have this obturator foramen here, and then there's a membrane that goes over it. And then the obturator internus is going to be coming from the interior side of that foramen, and then the obturator externus is going to be coming from the outside. So you have this, you have the foramen, and you have the membrane that's in the middle of it. One of the muscles comes from this side, the other one comes from the other side. So internus, this is the internal side, and then externus is going to come off of the other side, which is the external side here. And they're both going over towards the greater trochanter. And then same action, all the same. So here's obturator internus.
So they're like covering the...
Yeah, there's that membrane in the middle there, obturator, it's obturator membrane.
So they're covering that.
Yeah, one's on one side, one's on the other side. Okay.
Does the membrane cover the hole?
Yeah.
And so
There's some openings that there's different nerves and vessels that are going to go through there, though.
And
Basically, what it does is that it's just like in the, we talked about in the forearm. You have the membrane that goes between the two, the tibia, the radius and the ulna. So when muscles, the deeper muscles that are in here, they can attach from one bone, the membrane that goes between the two, and then the other. But obviously, there's going to be things that are going to need to pass through certain areas there for different nerves and vessels. Okay, so then here we have obturator externus, which is going to be coming from the other side of the membrane, and then it's going across. So it's kind of like the performance starting out on one side, and then it goes back around like this. Whereas the internus comes around this way, then the externus comes through here and attaches it. So they're both going to the same place, they just take different paths to get there. And then that leaves us with the quadratus femoris, which is the lower one of the six. So that's going to be from the ischial tuberosity to the greater trochanter, and then again it's going to be farther down on the greater trochanter than the others. And then the same action is going to be lateral rotation. So here's all the six of them together. You have the piriformis, then you have the superior gemellus, then obturator internus, then inferior gemellus, and then obturator externus and quadriceps femoris. So it follows that PGOGOQ. Right?
PGOGOQ.
And that's just kind of a review of the other stuff that we already talked about. Okay, so that's basically the material we're going to cover, and then we're just going to do it again by doing some more palpation type stuff and muscle testing and things like that.